This is the CODA. We would like to provide information about brain death organ donation. The CODA is a public institution designated by the Ministry of Health and Welfare under the Organ Transplantation Act. It receives notifications from hospitals when brain-dead individuals or tissue donation candidates are identified, and it carries out the responsibilities related to organ and tissue donation. Organ donation is when a person gives their organs to help patients with chronic organ failure without expecting anything in return. You can donate organs such as the heart, lungs, liver, pancreas, pancreas islets, kidney, small intestine, and eyes. Since 2018, the law also allows donations of hands, arms, legs, and blood vessels. One organ donor can help up to 9 people. Tissue donation is when a person gives part of their body to help others with health recovery or to prevent disabilities after brain death or death without any payment. You can donate bones, cartilage, fascia, skin, amniotic membrane, ligaments, tendons, heart valves, blood vessels, nerves, and the pericardium. Tissue donation can be made within 24 hours after brain death or death. It is possible for individuals aged 14 to 80 years to donate tissue. Brain death is a condition where all parts of the brain lose function due to serious brain damage caused by conditions like a stroke, brain tumor, or aneurysm, or accidents such as a traffic accident, suffocation, or cardiac arrest. Brain death and a vegetative state are clearly different. In a vegetative state, only part of the brain is damaged, and the person may still have spontaneous breathing and some movement. Organ donation is not possible in a vegetative state. In brain death, the person is in a deep coma with no spontaneous breathing or movement, and usually passes away within 2 weeks. Organ donation can only happen in a brain-dead state. When a person is presumed brain-dead, the law requires the hospital to notify the CODA. A coordinator then comes to the hospital. After assessing the patient's condition, if brain death is confirmed, the coordinator will meet with the family to discuss organ and tissue donation. Even if you registered your wish to donate organ and tissue while you were alive, you must have the consent of your family. If you agree to donate after the interview, one senior guardian will fill out the consent form. Senior citizens are legally determined in the order of spouses, lineal descendants, lineal dependents, and siblings or other relatives within 4th degree of kinship. After that, the 4-step brain death determination process will proceed. In adults, 2-step brain death examination are conducted by other specialists at least 6 hours apart, and flat EEG is performed for 30 minutes to confirm the absence of brain activity. Following this, the declaration of brain death is determined to be ethically, legally, and medically appropriate through the Brain Death Determination Committee. The time of death is recorded as the time when the determination is completed, and a death certificate is issued. After the organ donation surgery, the donor will be transported to the funeral home where the guardian is present. If consent for tissue donation has also been given, the body will be delivered to the funeral home after completing the tissue donation as well. Once the donation process begins, a social worker conducts consultations with the family and provides guidance on economic issues and administrative procedures. The social worker also shares in the grief and longing experienced after losing a family member, as well as any problems that may arise among the remaining family members, offering comfort in discussions that might be difficult to have with close ones. Additionally, the social worker provides economic, psychosocial, or legal information and connects families with community organizations. The website of the CODA provides an online memorial space for donors, offering donor memorial hall family gatherings and memorial albums to comfort the bereaved families and support healthy grieving. If you have any additional questions, please feel free to contact the medical staff or the coordinator in charge at the respective hospital. Thank you.